What if I told you that a condition with almost no symptoms in the beginning could become life-threatening for both you and your baby if it's not detected early? Today, we're talking about preeclampsia, what it is, the warning signs, and how you can protect yourself and your baby. Hello, I'm Nurse Jennifer, a registered nurse and midwife. Today, we're talking about preeclampsia, a serious pregnancy condition every expectant mother should know. What is preeclampsia? Preeclampsia usually develops after 20 weeks of pregnancy. It causes high blood pressure and can affect both mother and baby. The dangerous part is that many women feel completely fine at first. That is why regular prenatal checkups for pregnancy conditions are so important. One warning sign is a severe headache that does not go away. Never ignore a persistent headache during pregnancy. Other warning signs include blurred vision, swelling of the hands or face, pain under your right ribs, and difficulty breathing. Some women don't notice any symptoms at all. That's why checking your blood pressure during every prenatal visit is so important. A normal blood pressure is usually below 120/80. During pregnancy, a reading of 140/90 or higher needs medical evaluation. Your healthcare provider may also test your urine, because protein in the urine can be another important sign of preeclampsia. Blood tests can also help check how well your liver, kidneys, and blood clotting system are working if preeclampsia is suspected. Your baby will also be monitored closely to make sure they are growing well and receiving enough oxygen through the placenta. When preeclampsia is found early, doctors can monitor both mother and baby closely and decide the safest treatment. Your treatment depends on how far along your pregnancy is and how severe your condition has become. Some women may only need frequent checkups, while others may need to stay in the hospital for closer monitoring. If your blood pressure becomes very high, your healthcare provider may prescribe medications to help lower it safely during pregnancy. Never start or stop any medication during pregnancy unless your healthcare provider tells you it is safe. In the next section, let's look at who is most at risk of developing preeclampsia and what you can do to protect yourself. Although any pregnant woman can develop preeclampsia, some women have a higher chance of developing this condition. This is where we talk about the risk factors associated with this condition. Your risk is higher if this is your first pregnancy, because your body is adapting to pregnancy for the first time. Women expecting twins or triplets also have a higher risk because their bodies are supporting more than one baby. If you already had high blood pressure before pregnancy, your healthcare provider will monitor you even more closely. Diabetes, kidney disease, and certain autoimmune conditions can also increase your risk of developing preeclampsia. Being over 35 years old or having obesity may also increase your risk, but many women still have healthy pregnancies with proper care. Remember, having one or more risk factors does not mean you will definitely develop preeclampsia. It simply means you need careful prenatal care. Without proper treatment, preeclampsia can become very serious for both the mother and her baby. It can affect important organs like your brain, kidneys, liver, and lungs if it becomes severe. It can also reduce blood flow through the placenta, making it harder for your baby to receive enough oxygen and nutrients. This may slow your baby's growth or increase the chance of an early delivery if treatment is needed. The good news is that many women with preeclampsia have healthy babies because the condition is recognized and treated in time. The most important step is attending every prenatal appointment, even when you feel completely healthy. Never ignore severe headaches, vision changes, sudden swelling, or pain in the upper right side of your abdomen. If your baby's movements become noticeably less than usual, contact your healthcare provider right away for advice. Remember, early diagnosis and treatment can make a big difference for both you and your baby. Also, remember that every pregnancy is different, so always follow the advice of your own healthcare provider. I hope this video has helped you understand preeclampsia and the warning signs you should never ignore. If you found this video helpful, please like, subscribe, and share it with someone who may benefit from this information. Thank you for watching. I'm Nurse Jennifer, wishing you a healthy pregnancy, a safe delivery, and a healthy baby. See you in the next video.